Nice to meet you also.
Oh, Gary's gonna come on too?
Yes, she's going to join us.
Okay. Let me get him on
Morning, Dr.
Hey.
You're there. Hi.
Yusef.
there.
Yep.
All right. So why don't we get started? Tell me what's happening.
I'm having a lot of pain in my back at like right about here. That goes all the way down my leg. Initially, I was told it was sciatica.
Right.
Then they took an x-ray and told me that I had a herniated disc. They did a cortisone shot,
Right.
didn't work. And they wanted to do another one, which is where I stopped.
Right. So first of all, stand up again and show me where your pain is. It's not sciatica.
It's like right here. And then
Right.
it's a burning that goes all the way down my leg. And I also feel it in the front of my leg.
Right. Let me show you something.
Okay.
Gluteus medius trigger point chart. You don't have sciatica because it's not down the back of your leg. It's really almost more towards the side of your leg.
Yes.
And that is not. So I'm going to show you a picture and it's going to show you a red spot of area. And you tell me if this is kind of where your symptom is. Look at this.
Okay.
Running right down the side of your leg.
Yeah, that's it.
Right.
Yes.
So that is,
Which
if
is
you
why
kind of look here, you're going to see there's some X's. You see those X's on
Yeah.
the top here?
Yes.
That's the gluteus medius muscle. That's the muscle that here's an actual picture of the muscle.
My butt muscle, yeah.
Yeah, well, it's just on the side of it, really
Right.
kind of side. And that muscle is responsible for standing, balancing, and all that kind of stuff. It's actually right here. Okay. So what people don't recognize is that, and I had talked to Gary about this, that everyone always thinks that all referred symptoms are nerve because that's what you program to be told, especially since the MRI finds herniated discs and structures relating to the spine and the neurological system. But muscles refer symptoms. You know that because if you get a heart attack, you can have pain at the chest and the left arm. There's nothing wrong with your left arm, right?
Right.
That
right.
symptom at the left arm is being referred by the heart. And the heart is a muscle.
Right.
So there's no question that muscles can refer symptoms just as well. Right? So in your particular case, what we're seeing here is that your muscle is referring symptoms down your leg.
Only on that side.
Correct.
Okay.
So we can prove that that's what it is because if it's a muscle, then you should find that you have postural variations as well as functional variations because muscles are responsible for creating posture and for function.
Yes. At which point I should tell you, doctor, 2 years ago, I had shoulder surgery on my right arm, rotator cuff and torn ligaments, that had to be repaired. Then last year, my left big toe, I had bone on bone. I had a procedure done where they fused that toe. During that time, I was very off balance. I mean, I couldn't do both at the same time. They wouldn't let me. But my right side was off because I had the sling for what, Gary, months.
Yeah.
Then with my left toe, I was wearing a boot for a while.
Right.
So I might, and I waited a long time to get those things done. So that might be a reason that threw me off. And then when
that certainly sounds like it.
Yeah. Then when I tried to start exercising, doing sit-ups and stretches, then things just started hurting.
Right.
So
we can prove that, but just so you could appreciate the whole idea, and I want you to start thinking probably when you have pain, never going back and trying to go to the medical system to identify the cause of your pain, because you look at your situation. First off, you're being told you have sciatica. You don't even have the symptoms of sciatica. So that in itself should be scary. Then they're trying to convince you that sciatica comes from the spine because you found some herniated disc or something, right? So I try to explain to people, let's say they took the MRI and they found you had this herniated disc or stenosis or whatever you found, right? Now I take a hammer and I hit you in your hand and you have pain at the same time you have the herniated disc. Is the herniated disc causing your pain?
No.
Right. So where did this concept come from that says that because you have pain at the time you have a herniated disc, it means the herniated disc is causing the pain? It's a preconceived notion which has allotted this theoretical basis to sustain for 40 years. But it's bullshit. It's based on this concept known as correlative theory or junk science, which simply says that if something happens at the time something happens, the thing that happened is the cause of the previous thing. So if I open my front door when the sun rises, I can say opening my front door causes the sun to rise.
Right. Understood.
And that is the theoretical basis. So the MRI would find you have two elbows, right? You do have two elbows. So why isn't two elbows the cause of your pain?
Right.
It's meaningless. So what you need to always do is think about your symptoms and recognize that the symptom itself is being elicited by the tissue in distress. The tissue that is not functioning properly is trying to create awareness to you that it's not functioning properly. So it elicits a specific set of symptoms to help you try to identify it as the tissue in distress so you can perform the proper intervention, resolve the distress of that tissue. Then it doesn't elicit the symptom anymore.
That makes perfect sense.
That's the way it works. It's been like that for
grasp.
Right. Since mankind has begun, it's always been that. You know, it's very funny. People don't have a problem if you're sneezing. You basically understand you have an antigen in your nose, some irritant, and your body is trying to get rid of it. Right? If you cough, there's something in your airway and it's trying to get rid of it. So pain is exactly the same thing. There's a tissue that's not functioning and it wants you to know so you can fix it.
Okay.
So you got to, if you're not unwilling to look at the symptoms, then you're basically kind of saying to yourself, you know what? I don't really care how the body works. I'm just going to go on this other path. And that's what they did.
Right. And the problem is when you don't know what is going on, you go, let's say, to a surgeon, they're going to want to do surgery. When I went for my back, I specifically did not go to a surgeon because I'm like, I'm done with this.
Right.
There's no one like you out there.
Right.
You know, and just to be completely comprehensive, what also is my arms here, I'm, right here on both my arms.
Yeah.
Are very sore. Like I've been lifting weights.
Right.
But it's not getting better.
Right.
In other words, it's not like when I do, full disclosure, I watch my grandchildren.
Right.
That's my.
Those the weights you're talking about lifting?
Maybe, yeah. But you know what? That's okay. Hurting because I'm building up muscle is fine.
Well, you have to be very careful.
Right.
You have to be very careful. So
the right way to do it.
Right. Well, it's not just the right way to do it, but it is to say that you're isolating all the muscles required for the functional activity. You may need 10 muscles to lift your grandchild, right? But what if 2 of them are weak and 8 of them are strong, and you're only able to use the 8, but you require 10? By definition, you are going to be straining those other 8, and eventually they'll lead to a symptom, which is the soreness that doesn't go away. So the answer isn't, okay, well, I know that I'm using my muscles, so that's good. The answer is the symptom that's being developed is not the type of healthy symptom that goes with growing muscle. It's going with straining muscle. And therefore, it's an indication that somehow all the muscles required for the activity are not available or not strong enough. So you would need to find out which of your muscles are weak and then strengthen all of those. When you're creating isolated strength training, working one muscle at a time, and you get soreness, the high probability is that you're using the right resistance, the muscle is growing properly, and you're just getting the inflammatory response that's associated with growing a muscle. If you're doing an activity and you get sustained soreness that doesn't go away, that is an indication that all the muscles aren't available with all the proper strength and you're straining muscle.
And that's what I need to.
And that's bad. So you need to resolve that situation.
Gary, you're right. He's amazing.
It's
Yes,
just
no, it makes
logic.
so much-
I am a pure
makes so much
logician.
sense, though. You know, Gary, I'm like Gary, you know, I never had surgery. I never went through anything like I have with my shoulder and my foot that just happened the past couple of years.
Yeah,
So I'm not, it's like, it has to stop.
yeah.
Because
Oh, God.
like
yeah.
I said, my
And-
shoulder, my back, all of a sudden, it's like, now what is going on? But it makes.
Well, the
perfect
scary
sense.
part is, so what you're describing is what everyone goes through. You start off with an initial pain. You seek medical attention. They have no clue how to resolve the cause of that pain, which in 98% or greater cases is muscle. So you never resolve it. That muscle remains weak. You're forced to compensate in the way you do things. That leads other muscles to have to overwork, eventually leading to pain in other areas. And you get this horrible cycle of pain here, pain here, pain here, pain here. And you just can't comprehend what's going on because I'm having all these different pains, when in fact, it's just a succession of compensations. You're just changing wherever your pain is now changes how you do what you do. And so you lead to other muscles straining. So that's all this is for everybody. It's always the same process. And what's scary is that once you start on the cycle, you don't seem to end the cycle. You always seem to be having another pain coming down the road. And it's disheartening, scary,
It
and
is-
you're looking to a system that will never be able to stop the cycle.
That's exactly where I am, doctor. I was when I said to Gary, you know what? I'm at a loss
Yeah,
because I'm not going back to a doctor.
good.
You
Yeah.
know, I'm not getting.
And
another-
that's kind of, although I have the title of doctor and I have a doctorate in credential for physical therapy, by no means should anyone ever associate me with the medical system. I am basically the antichrist of the medical system. I am trying to stop everybody from going there, unless obviously there's some sort of emergency type situation. But in terms of diagnosing the cause of symptoms, that's not the place, because they're dependent on, they have put all their money on the concept that diagnostic testing is the answer, and it's clearly not. And if you notice, within 2 seconds of you saying your symptom, I know what the symptom is.
Yeah.
Because I've cataloged for 28 years symptoms with causes. So
Makes
I
perfect
kind of
sense.
connect. I kind of have figured out. And by the way, if you had a lady's talking to me about a bone related issue, there are specific symptoms for that. A neurological issue, there are specific symptoms for that. I'm not denying that there aren't going to be circumstances where it potentially can be bone and neurological, but it's the symptoms that will tell me that, not some diagnostic test.
Right.
So I just got to tell you, like, really kind of a really crazy thing, how bad this can get. So there's this dude and he ends up getting neck surgery for altered symptom that he had in the hand. He was told that it was from something in his neck. Okay. It turns out that the guy had the same exact symptom in both hands. He had altered sensation in both hands. He gets it was an EMG test is what it was, that measures nerve conductivity. And the nerve conductivity test that he said that he had altered nerve conductivity in one arm, and therefore he needs a surgery to this nerve, and he ended up getting it. But that seems rather confusing because he had the same exact symptom in both hands, and yet it said that on the one side, the nerve conductivity was normal, but the other side, it wasn't normal. And so how can you associate that test with the symptom when he has the symptoms in both hands?
But the doctors make you feel like you're stupid. You know, it's sort
Pure
of.
coercion.
Yeah.
It was pure coercion that this poor man got a surgery irrefutably. I mean, no, you don't have to be a scientific giant to recognize there's no way that you could say that the altered nerve conductivity on one side is creating symptoms when he has the same exact symptom on the other side. I mean, that's how perverse this stuff gets. So, I think Gary knows, and certainly John knows, I see myself as your defender. I'm the guy who's just between you and trying to find a sane understanding and a way to move forward. And that's why I take it very seriously. It seems like this was my chosen destiny, and I love doing it. And you'll be able to see. So let's talk about your symptom now. Your symptom, obviously, I would assume you'll tell me, worsens when you weight bear, you do things standing, things like that.
Yes, I get, when I'm on my feet, there are times I literally have to sit down. There are times I've actually like sat down like this, I'm in so much pain, and I'll just sit like this and just, and then I feel
A stretch. You're in a sense, you're stretching your muscle.
Yeah.
How do you like that? See, that's the funny part is that people intuitively seem to find a way to try to relieve their own symptom. They just don't know what the tissue is that they're trying to address. And if they did, they'd probably be able to resolve this on their own.
Right. But again, like you said, it's just isolated where you're feeling that one spot. You're not dealing with the whole muscle.
Right.
And then again, it is all those other muscles I'm compensating for that I know is causing this other pain. I'm totally, out of whack.
Yes. All right. Let's see you stand up now and put your hands on your pelvic rims, which you would just say is your pelvis. Right.
Right here.
Yep. And so kind of make sure you can push in on the top of that pelvic rim. Okay, there you go. There you go. All right. Oh, I can see. Okay, so it looks like the right hand is higher than the left hand. Yeah, the right hip is higher than the right. Okay. All right, let me see you stand on your left. Just push the camera down so I can see your knees. Just a little bit. Right there.
Okay.
Okay. Stand on your left foot.
You said better balance, but can I hold on?
That's all right. That's what we're looking at now. Okay, stand on the right foot. Okay, stand on the left foot. Now try to bend that left knee like 3 times if you can. 1, 2, good. 3, good. Now try the right foot. 1, whoop. 2. You see how hard it is on that side?
Yes.
Much harder.
Yeah.
And Gary, if you're looking, you would see as she goes down, can you see her right knee caves in completely? It's literally passing the inside of her foot.
Yeah.
Right? So the idea is that the glute med that sits on the side of the pelvis. Okay, Pamela, just take a look at this so you can see this, because this is really cool because you can understand what's happening.
Yeah,
This is your gluteus medius muscle, and it's attached to the side of the pelvis, and then it's attached to the hip joint.
yes.
And for every muscle, whenever you're going to create motion, you basically have a stable side of the muscle and then the moving side. And the moving side is always moving towards the stable side.
Right.
So if we were to look at you standing on this leg, let's say this is your right leg, then we would imagine that this is the stable side and this is the mobile side. And can you notice that the fibers are vertical and this is slightly outside this? So it's not just pulling up, it's pulling up and in. It's pulling up and in. And what that would do is if you were to pull on the femur portion and your leg was free, you would see your leg would come out, right? Because it's going to move this way. If this pulls up and out, this goes this way, right? Well, what if this is weak? If this is weak, this isn't just going to stay vertical or out. Which way is it going to go? In.
Right.
What happened to you? Your leg went in. So what it says is your glute med isn't strong enough to sustain that posture, right?
You could see that right away. Yeah.
Right. Now, when you did the single leg squat, the other thing, or the stand, I think it was, what I also noticed was when you stood, this fell. The left side fell. You could see this was happening when you took your left foot off the floor. Okay, we're going to look at it in the reverse concept. Now, this is the stable side and this is the mobile side. Okay, so here we're going to try to pull on the pelvis and pull down. If this is pulling down properly, it creates this movement. But if it's weak, can it keep the pelvis up on this side?
Down.
What's it going to do?
Go down.
Fall.
Yeah.
What did yours do?
Fall.
Fell.
Wow.
I mean, that's how the muscle works. I didn't make that up. That's
Yeah.
God's work. That's evolution, whatever you want to call it, right? So I just learned to explain it. And again, all I'm doing is explaining the presentation of what happens to you when we do certain tests or when we look at your posture, and then be able to show you that this is the muscle that's involved and this is what it should do and this is what happens when it's not working. And that's what it looks like when you do what you do, right?
Okay.
So you
That
can,
is one muscle right there, doctor. That muscle you're talking about, that's all connected. Is it
I'm sorry, say that again. What was
that
it?
one muscle?
That is the primary muscle for balance and stability. It's the muscle. So what's so fascinating is this is very prominent here, but if you looked at an animal that walks on all fours, they wouldn't have a gluteus medius. They would be very, very small. You have to understand, we only have 2 legs to stand on. And that's what makes the gluteus medius the most magical muscle in the body, because it's the only muscle required that's responsible for balance. If you take this leg off, if you lift this foot off the floor, you only have 2 points of contact to stand. You take one off, this has to fall. It would have to fall because there's nothing supporting you anymore.
Right.
So the only thing that stops you from falling, amazingly, is the muscle on the opposite side of the leg that you took off, being able to take the pelvis and pull down towards the hip joint at an equivalent force. It has to create an equivalent force of whatever the force is that this bone is supporting.
So besides the struggle with it, is that why my balance is so off?
That is the answer to balance. That is correct.
That would have been an indication, because I did notice that a while ago, years ago.
Correct.
That was, wow, my balance is off, but I never paid attention to it.
This is the answer. So what kind of pisses me off is people get older and they're told, oh, they're having balance issues.
Right.
What is the medical establishment's answer to that? Use a cane. Well, once you use a cane, part of your body weight will be supported by your arm.
So you're not building up anything.
So if you take the requirement of muscle to support you away, does that make the muscle stronger or weaker?
Oh, weaker.
Weaker.
And
So
then
you're
you-
progressively now
that's-
weakening your legs. Now suddenly you're using your cane and you fall. They're going to say, oops, the cane isn't enough. You need a walker. Well, I've seen people put 40, 50, 60% of their body weight on that walker. What's going to happen to your leg muscles? Weaken further. You're going to fall with a walker. They're going to put you in a wheelchair. You're dead. Give up. Close out life. I watched what happens when someone ends up in a walker. You don't come out of a walker. I mean, a wheelchair. You don't come out of the wheelchair. You're done. So their premise is that balance deficits can only be helped by using external appliances. Why? Because they don't understand what balance is created by. It's created by muscle. All right. So there is the sensory awareness of where you are in space. That is true. And that happens with the semicircular canals in your ears and your cerebellum. But the way this is, I want you to understand how simple this is. So someone says, oh, I think you're having a neurological deficit. It's your semicircular canals in your ears. Well, the answer is sit up unsupported. If you were having a balance issue associated with your semicircular canals or your cerebellum, could you sit?
No.
You wouldn't be.
Though, right?
You wouldn't be able to find your center and you'd be flat.
Like you're on a
So
boat.
as soon as someone shows that they can sit perfectly but can't stand, bingo, done, over, game over. I guarantee you 100% I can perfect your balance.
Let's do it.
And that's how this whole thing works. So, all right. So would you agree that I seem to have a fairly good understanding as to what is creating your symptoms?
Absolutely.
And we understand it's muscle.
And it's clear. Yes.
No
It makes
question.
sense.
Where your symptom is, what the postural presentation is, what the functional limitation is, everything about it says it's just you have a strained glute med, which it certainly sounds like you can even point to when this whole process began. So, I mean, you've got all the pieces telling you, we just got to strengthen your glute med and 2 other muscles and you're good to go.
Yeah, it just seemed, once I started with the shoulder and, been trying to keep up with my grandchildren, but I wasn't able to do it for a while. Then my foot, then, I was done. Okay, that's done. And when I started to get back into shape or just start doing my normal stuff, that's when things just started hurting.
Right.
So, yeah. So yes, let's do it.
And so in your particular case, part of what the issue is that your level of functional requirements pretty high. You're lifting kids up. I mean, this is strenuous stuff.
Yeah.
So
But if I don't do something about this, I won't be able to do that.
well, it's going to progressively retard because you're going to have less and less as you compensate. You're just straining more and more muscles to eventually there's just no muscle left to strain. You just can't function.
Right.
So
that's why I want to do this, but also I need to be clear about what I can be doing during this process. In other words, what I'm able to do with my grandchildren, and if there's anything that's going to hinder or work here, you know.
So
building it.
here's the premise. This is the premise of the way I try to describe what can you do functionally, right? If you do something and you end up having pain, it's an indication of a tissue in distress. So it tells you that the functional requirement of the force requirement of the activity is greater than the force output of your muscles. That's what it means, right? So you've got a choice. You can continue to do what you want, but still get pain, but still know what the cause of the pain is, that it's muscular, and you're in the process of healing that, resolving that by doing the strengthening. Or you could stop doing that level of activity, try to minimize the force requirement by limiting what you do. You won't get the symptom. And in the meantime, you are strengthening. And eventually, as you strengthen more, you progress the resistance, the muscles get stronger. You'll be able to increase your force requirement, your activity level without pain. So this is not, Russia or China. I don't tell people what to do. That's not my job. My job is to teach and to educate. If you just have an undying love to play with your grandchildren, who the hell am I to tell you not to do that? That's sick. That's a sickness. And those people should never be in the medical field because they don't understand what they're doing there.
Right.
My job in that case is to make you understand that you're straining your muscles. The good news is straining and tearing are two different things. You're not tearing your muscles. You ain't tearing it. You're not making anything crazy worse. Forget that crap. You're just irritating the muscles. So if you're willing to take that level of pain, which is fine, and you can heal up, just take solace in knowing you're strengthening your muscles. Now we're going to make them stronger, and very shortly, you're not going to have the pain.
Okay. This is an example of what I've been doing because of my arms. When my granddaughters, they run to me 4 and 2 years old, I'd pick them both up.
Yeah.
When they run to me, I sit down. Literally, I sit down on the floor and they come to me and then I hug them.
There you go.
So that's where I adjust.
So you found a way to reduce the functional requirement and still get the joy out of it.
Right.
And that's great. That's great.
Sure okay. Yeah.
I think that within just a couple of weeks of you doing this 3 times a week, you'll see that I would imagine within 4 weeks, you'll be able to stand and hold them and you won't have a balance issue. And it isn't going to take long. We're talking weeks here.
All right, let's do it.
All right.
Okay. Yes, sir.
All right, you have your resistance band in your chair. I know you have a chair. You have a resistance band.
Chair right here. That's the chair. Okay. Yes, sir. Yes, sir. Okay.
Does that make sense, Gary? Everything I said?
Yes.
Yeah, absolutely.
That's amazing. Okay.
I'm just gonna, without influencing any of this or getting into this discussion, what my sister does, God bless her, is she watches 3 grandchildren 10 hours a day, 5 days a week.
And
Wow.
I'm living the dream.
And so I think, just a discussion, obviously this is a decision that, Pamela, you'll have to make with all the information that Dr. Yas is giving you. You might want to just cut back on that a little bit
Or just
as you're going through this, because that's, maybe not 5 days a week or something, or, whatever. So anyway, I'm just throwing that out there because that's
She
just,
has to find it. It's within the person's,
Right.
they have to figure out where the best place in their life is to be.
right.
And I always want to be that. I don't want to be the person who says you cannot, I told you the story of the golfer who just retired after 40 years of killing himself so that he has the life to play golf. And then he gets back pain with golf. And he goes to the doctor and the doctor says, well, you're going to have to give up golf. I've had people who were golfers who have said, you might as well shoot me. I don't understand what you're telling me. I just lived 40 years. I just committed 40 years to this point so that I could play golf 5 days. And you're telling me just walk away from that? Are you out of your mind? Are you so disconnected from reality that you would tell someone who just invested 40 years of their life to do this thing, don't do it? And it's so commonplace. It's scary.
Yeah.
And my job is to teach.
And mental health is huge for physical health.
It's everything. Yeah. Living is about physical, mental, emotional, spiritual, and you need to combine them all. So
Learned how, I've spent my career in front of a computer, now suddenly I'm living the dream watching
Right.
my children. So then I've started to learn to adjust accordingly. I've
good.
to one extreme or the other. but now.
It sounds good. That sounds good. I think you're in the right direction. This is going to help you really good, really fast.
Okay.
All right. So let me show you the first exercise.
Which way do I turn the chair?
Hey, I'm going to set it up. You're going to follow what I show you. Oh, jeez. All right, Gary, we're starting that thing with the 10-minute stuff again.
Here you go.
So we'll get this exercise in and then we'll, let me get this off here. We'll get this exercise in and then we'll close it and reopen it. All right. So Pamela, watch this, okay?
Yes.
So what we're going to do is we're going to take the band.
Take it out of the door?
Yeah, take it out of the door.
Okay.
Okay, and I made a little knot here and I made a loop,
Okay.
okay?
Yes, sir.
Good. Okay, I'm gonna take the loop with the knot. I'm gonna put it through the door and I'm gonna have the knot on the other side. I'm gonna close the door and that's gonna leave a loop.
Also, I have two of them. Wait, I've got this. Okay, like this.
It's gotta be under the hinge,
Okay,
below the hinge.
all right, got it. Sorry.
There you go.
Okay,
Good,
like this.
excellent.
Does it go on the side or, yeah,
Yeah,
those.
right here.
Close. Why isn't this not closing?
Make sure that the knot is completely free of the door. Just the band is coming through.
Okay. All right. Okay,
Okay. All right. So now we're gonna put our feet into the band, into the loop.
my right leg, obviously, right?
Okay. So can you see that I have my feet in the loop?
Both of them?
Yep.
Both, okay,
Both feet are in the loop.
okay.
Okay. Now what we're gonna do is we're gonna take the right foot. We're gonna just turn it in so my toes are pointing to 11 o'clock, and it's always gonna be at 11 o'clock through the whole exercise. I'm gonna have my nose directly over my left foot, okay? And now what I'm gonna do is I'm gonna move my right foot out. See, I'm just moving it out that little bit, just enough until the outer portion of the ankle meets the outer portion of my hip. Then I put my foot down. Now I move my nose over my right foot, and you can see my pelvis is shifting until it's over. Then I'm gonna bring my nose and my foot back. So it's out, down, over, back.
This is on my
Out.
right foot?
Huh?
This is my right foot.
This is your right foot. Oh, you're on the wrong side. You gotta turn around.
Okay, that's why I'm confused. Okay,
Turn around. You turn around. You got the wrong way. Yeah.
all right, I knew something.
Your right foot is on the outside.
All right, here we go. All right, here we
Okay.
go.
Okay. So now move the right foot out just a little bit.
Okay, yep, okay,
Put it down on the floor.
yep,
Shift your weight over onto it. And now come back. Foot and your body.
okay.
Move the right foot out. And just if you can, push the camera down a little so we can see your
Yeah,
feet.
that's what I'm
Yeah.
doing.
There you go.
Now you see me?
Yep, perfect.
Okay, here we go. All right, okay, so,
Put your feet through. It should be around your ankles, not under your feet.
okay,
There you go. Okay.
all right. Okay, right, out,
Shift over and then come back. Move your body. Watch me. Your foot is out. Now I'm just shifting my weight to the side and then I'm coming back. Bringing my foot out, putting it down, shifting my weight to the side. Shift your weight. Right. Now you could move the chair forward so that you're coming directly out. Move your body towards the chair more. Move your whole body like your feet. There you go. Now you're in more of a line. Okay, your feet have to be together. Okay, now move the foot out. Put it down. Shift your weight over onto it. Don't rotate yourself. You're just shifting straight over to the side.
Okay.
Now come back. Good. Now do it again. Keep your knee straight. Your knee has to remain straight as you pull over. Shift. Now come back. Go out. Better. Shift over onto it. Come back. Good. That's 2. We're going to do 10. 3. Good. Keep that knee straight. 4. You got to keep it straight. Pull from the ankle. Yep. Shift. Good. 5. 6. Good. That's getting better. 7. Good. 8. Good. 2 more. 9. Good. 1 more. This looks like you're getting good job with it. 10. Rest. Okay, take your feet out and sit down, and we're going to just talk a second about that.
Okay.
All right. How did that feel to you?
Really good. Yeah, when
Okay.
you got it right.
You feel it? You feel it working right on the top there at the top of the pelvis?
And with all the stretching I have done, I've never tried anything like that.
Yeah, this is there. This is pure isolation. So it's all about getting the technique perfectly to maximize it. So once you got it, everything was good. The distance you were going out. So if it starts to get easy, do you ever increase the distance you bring your foot out? No, never. Because once you go with the foot outside the hip, you're actually working a different muscle.
Okay.
So it's only this small distance. The only thing we ever change is the resistance level,
Okay.
how hard the resistance is. To make the resistance harder, we simply move our feet out away from the door, maybe 1 inch to 2 inches more, which is going to mean the band has to stretch more, and that creates more resistance.
We don't have to get a different band.
Right now, no. You could get 2 to 3 at least, or 4 progressions on this for now. Okay. The only other thing I noticed was that your foot was pointing straight. Just try to keep it pointed to 11 o'clock. Have your toes. So the idea is if this is straight and this is this way, my heel's the first thing that's moving out.
Okay, should try
Okay.
again.
Now we're going to wait a minute in between each set, because right now you're building lactic acid up in the muscle, and the byproduct of lactic acid, the byproduct of muscular contraction is lactic acid. That impedes muscle contraction. You cannot get rid of the lactic acid until after the muscle stops contracting. So we wait a minute in between each set. Okay. Then we're fully ready. The muscle's all available to do the next set. Okay. And then the last thing is about how hard this should be. So if I said, how hard would you say that was? 0 to 10. 10 is excruciating. You're going to tear a muscle. 0 is like doing nothing. 8 is like if I said, could you do an 11 to 12th? You'd say maybe, but that would be tough. And 5, if I said, could you do 15 or 16? You would say yes. So what number would you associate to how hard that was?
5.
5. Okay, good. So we're going to have to get off in a second. So what's going to happen is, because we have 3 people on, this only gives me about 40 minutes. So I'm going to close this out. Just wait about 2 minutes and just click back in again.
Okay.
All right. And then we're going to start again. And then we're going to do your next set.
Okay.
All right, Gary?
Doctor.
Okay, very good.
All right. We'll see you guys in just a second or two.
See you in a bit.
Okay. Let me just close this.